everybody, my name is Caleb, and today I'm going to be doing my presentation on WavelinQ. It's about the SWOT analysis, marketing plan, and the growth strategy. I'm going to apologize in advance. My son is in the background, so if you hear some grunt noises, that's my month-old son. So let's get started. So the kind of an overview on WavelinQ. It was developed by TVA Medical, which is a medical device company. It was actually bought out by BD Bard. And then, so BD Bard has control over, it used to be known as Everlink, but now it's known as WavelinQ. And what it is it's an AVF, or an arteriovenous fistula creation device for people who are on hemodialysis. And what this does is endovascular, and it avoids traditional surgery. So some more overview on WavelinQ. The newest version is the 4 French, which is just talking about how thick or the diameter of the system. It's the 4 French Endo AVF system. You get arterial and venous access in the arm. As you can see here, it's kind of hard to tell under fluoro, but they have arterial and they have venous access. The device sheaths are inserted. The catheters and wires are used to cannulate the correct artery and the communicating vein. And then the WavelinQ catheters are inserted. Once they're inserted, the artery and vein are brought together, just like this, like you see in the picture. You know, you can't hardly tell the difference right there. So when they're brought together, an electrode that you can kind of see right here, an electrode just burns it through radio frequency and basically ablates it, and that's how they create the anastomosis. So that's kind of how it works. Just a little overview of WavelinQ, what it is and everything. So today what we're mainly going to be talking about is the marketing plan, the SWOT analysis performed, and also the recommended growth strategy for WavelinQ. So their mission, BD Bard's mission for WavelinQ, it's hard to say, is provide patients with better success rates, maturation, and intervention rates of their AV fistulas. Because the traditional surgery route of creating AV fistula is far from perfect. And as we keep going, we'll learn about some more clinical trials of WavelinQ and kind of learn that they're a little bit better than the traditional way of creating an AV fistula. So another part of their mission is to market to patients and physicians. What they want to do is they want to market to them that their options, that their system, that their product provides better and more options, that it is ultimately in the long run less cost than surgical procedures, and also that it has more desired results than traditional surgery. And then some of their goals. So right now their current goals, after talking to Stephanie Moy, who is also, she's a clinical representative for BD Bard and specifically in WavelinQ. So what she says is they want to increase the product's image. They want to increase its validity, basically. They do not actually want to maximize the use of their product, which sounds a little strange, but they don't want to get their product in the hands of anybody and everybody that they can. What they want to do is they want to increase what the product can do. So they don't want to have it in just anybody's hands, because they want to ensure that it's appropriately used and it's safely used. And also so that those people, those surgeons is who they're really marketing to, can come up with different ways to use it, or different procedures to do with it, or just come up with out-of-the-box thinking. And they want it to be, they just want their product to be successful. And I think that's the reason that they're not marketing to really everyone. And they also, one of their goals is to help the company continue to grow into higher growth markets. So, that's kind of what they're having WavelinQ, Venovo, Cavera, and other things that CR Bard offers to BD, because BD and CR Bard joined together. So CR Bard has the WavelinQ, and BD wants to use WavelinQ along with CR Bard's other devices to just continue to grow into higher markets, basically. So some of the core competencies of this device, one of the main ones is to provide an innovative, safe, and better option to patients and surgeons for AV fistula creation. We continue, and they want to deliver excellent training services and deliver their products through effective manufacturing and distribution systems. So as with those core competencies, we have the competitive advantage. So what they think the competitive advantage for them is, it's a safer anastomosis when you compare it to their competitor, who is ellipsis. And the reasoning behind it's being safer than ellipsis is that it uses radio frequency and not thermal energy. As we mentioned before, the radio frequency kind of ablates the artery and vein wall, and it creates that anastomosis. Well, ellipsis uses thermal energy, so it burns the skin. It's more of a burning, which can produce more hyperplasia, as well as it can just increase the scarring inside the vessel, and so it's not as safe and it's not as healthy. And so some more competitive advantage, they have proven results and established relationships with their suppliers and distributors. So they have great relationships with them, and they've been proven to pan out and really just produce time and time again. And the last thing for their competitive advantage is the training team. They have an excellent, skilled training team. Their clinical representatives, device representatives, their sales representatives, all of them are highly skilled. They've been in the field for years. And then as well as the physicians, they are the most trained people for this device that could possibly be, according to Moy. So those were WavelinQ's competitive advantage over ellipsis. And then, let's kind of look at the SWOT analysis. So a SWOT analysis, if you don't know, strengths, weaknesses, opportunities, and threats. So we're going to identify those. We are going to identify the strengths and weaknesses through internal factors in the company. And then we're going to identify opportunities and threats by kind of looking at environmental trends that are going on in the world and how they may affect WavelinQ in general. So here's the chart for your strengths and weaknesses, as you can see, and there's the internal factors up there. So the first one, the product. The product, it was actually Everlink at the time, but BD Bard overtook that and made it WavelinQ. They're the first endo-AVF creation device. They received a 510K from the FDA for their WavelinQ 4 French system. They have clinical trials. The results were better than the traditional surgery route. So the percentages of success from the procedure, the maturation rates, as well as the rate of intervention was less with WavelinQ than it was with traditional surgery throughout the clinical trials. Now, some weaknesses with the product. It is costly. Nobody ever really gave me an exact price, or I can never really find an exact price on WavelinQ, but Stephanie Moy, she assured me that it was costful, but she also said that it would potentially be more cost effective than surgery due to maybe complications, infection rates, and extended hospital stays and such like that. So all of those would be lessened with WavelinQ, potentially. And then some more weaknesses of the product is strict patient criteria. Only about 30% of the hemodialysis population are candidates for WavelinQ. And then it's the small clinical trial study. They had less than 75 on the clinical trials on clinicaltrials.gov, which is pretty low. So it's kind of a weakness for them. And then their marketing is great. They have a good balance between consumer-driven healthcare and traditional healthcare marketing. They market to patients with saying that it's going to be no surgical scar. You don't have the risk of infection, and that as well as they're marketing to surgeons and other physicians in a way that just really creates that they're going to be that specialty, that they're going to be that center around, they're going to be the only place that can do these within whatever radius around them. Therefore, they're going to funnel the patients towards them, which will increase their overall fistula correction in general, but hopefully as well as WavelinQ, of course. And then also with their marketing, their distribution across the U.S., they have it in the U.S. market, they have it in other world markets across the world, rather. But some weaknesses, they're selective, and there's a selective and small target audience with the physicians. So they kind of are, but they're not really seeking out interventional radiologists and interventional nephrologists. Their main target audience are vascular surgeons and or maybe general surgeons, but surgeons in general are their target audience right now. And like I said before, they want to do that to keep it a specialty, to see what can be done with the product before they. I really don't know the reasoning for keeping it so selective, but that is a weakness because your product's not going to grow and you're not going to see the revenues that you could see. So the personnel, they have a strong and skilled workforce, 65,000 people, pretty impressive. They utilize their clinical and sales representatives effectively. But some weaknesses, that large of a workforce for that company requires excellent management, and also requires, good placement or allocation of employees. And as time and time again, I hear, some issues that people don't like within medical device companies is their performance is dependent upon their sales. It's dependent on their revenues that they create. So, I kind of see that as a weakness because it may not promote the best environment for the workforce. And then for manufacturing, supplier ensures and continues to produce high quality. They're just their supplier. They're just great, according to Stephanie. And then inconsistencies in procedural scheduling and physician demand may produce inconsistencies in inventory and stock. So if a physician says, "Hey, I want to do this case," all right, you get everything ordered. Oh, well, the patient has this problem with them that we didn't know about after all our research, and we can't do it anymore. So what happens with that product? Well, it sits on a shelf until it can be used again, right? So counteract that. Okay, you hadn't had very many procedures going on. Well, all of a sudden, a physician wants to do one tomorrow. Well, they can't. They're not able to. So since they're not able to at that very second, that can be a little frustrating for the physicians, and therefore it's a weakness. So here's your opportunities and threats for WavelinQ. And remember, these are external factors from the environmental scanner. So some social trends. So the ESRD population is increasing. It's been increasing ever since 2005. Another opportunity for WavelinQ is avoiding surgery will increase patient participation. So with patients, the fact that patients don't have to go through surgery, have the surgical scar, have the risk for infection, it's going to make it more appealing to patients. So, and then as well as more access to internet will increase patient knowledge of procedure. So the more that WavelinQ advertises their product online and social media, etc., the more patients are going to see it, and therefore more patients are going to want it. The threats: patients, physicians are skeptical of new devices and are quick to scrutinize, which is very true. New devices can be scary and just cause a lot of question. So some economic opportunities. Inflation will average 1.9 in 2020, which may mean lower interest rates. And another opportunity: the majority of dialysis patients are on Medicare, Medicaid, meaning reimbursement for organizations could be optimal. So all dialysis patients typically are on Medicare and Medicaid, and so they don't have to pay for that astronomical amount of health care. And then threats: issues following the coronavirus outbreak has caused the stock market to see major losses. So stock of WavelinQ could be negatively affected, and WavelinQ or BD Bard may not see their shareholders or their stock holders contributing, or see a less amount of those. And then for technological, there's cloud storing and sharing nowadays that has become more popular, and it allows for higher and easier information storage as well as sharing. And then there's extended reality devices like VR that make training and simulation cost effective and more convenient. So it really helps if there's a time constraint or if there's a patient constraint, you don't have the volume. But some threats, use of AI and other innovations in technology may create future devices that make WavelinQ obsolete. Right now, the competition isn't that great, but as we move to competition or competitive trends, the ellipsis, they use thermal energy, as we mentioned before, to create the anastomosis, which increases the chances of hyperplasia and scarring of the vessels. So that's an opportunity for us. We're safer, technically. An additional that I forgot to put here, though, is their 6 French. They are a 6 French system, and the higher the French, the more complications that could come from the procedure. So WavelinQ is 4 French, therefore it's safer. Now, some threats, they may be exploring other options for the device. Right now, we just use it for right now, WavelinQ just uses it for radial and ulnar arteries and your brachial artery. So they may be exploring more ways, like they may be exploring thigh fistula or more, which WavelinQ is not right now. And then some regulatory opportunities. Overall cost of the device will potentially be lower than traditional surgery and in alignment with Medicare and Medicaid. So we know that Medicare and Medicaid wants high quality, low cost care. And if WavelinQ really does prove over time to lower costs due to lower infection rates, shorter hospital stays, and whatnot, then it will be in alignment with Medicare and Medicaid and increased reimbursement. However, there's some other issues. Europe's new medical device regulation and in vitro diagnostic medical device regulation replaced the medical device directive in May 2020 and May 2022. So there's going to be some changes to the medical device, just to the medical device world in general, what it takes to get approved, and just what it takes to be in alignment with regulations. So that's going to change in Europe. Therefore, WavelinQ needs to be prepared for that in their world markets for sure. And then after more observation, the cost of the device may not fit with low-cost healthcare. It may fit with high-quality healthcare, but it may not fit with low cost. Therefore, it may not be in the alignment. It may not be in alignment with Medicare or Medicaid, and then you worry about reimbursement being an issue. And so now finally we get to our growth strategy. So growth in terms of expanding the amount of physicians and hospitals that use our product really isn't the goal. That's from Stephanie Moy, the clinical representative. So their goal is to increase what they do with the product. They don't want to increase the volume of physicians or of hospitals that they sell it to. They want to increase what they can do with the product, therefore create more business that the product can do. You remember they had the small criteria, so if they're really trying to expand that criteria so that their device can be used more and more. The reason they don't want to give it to anybody, and the reason they don't want to maximize their volumes in terms of physicians, is they want the procedures to be done safely. They want surgeons and physicians who are adequate and who are adequately trained to be able to do this. So they're really focusing on who they pick, and they're very selective in their process because they have total autonomy and the say of who uses their products, which is really good. That the FDA gave them that. And then some more growth strategy. So I would recommend that they do a product development strategy. So Karen Hartley and Rodelius, they define the product development strategy as a marketing strategy of selling new products to current markets. Okay, so this is somewhat of a variation of that. It's not going to be a new product, however, but they are going to make changes that increase the usability of the current product. So they're not making anything new, but they're making little tweaks and changes to the current 4 French system, and that's what's going to give them the more of a competitive advantage that they already have. So that's kind of what I would recommend them do. And then in conclusion, so WavelinQ is an up-and-coming device. It's here. It's going to continue to grow. They've already had 1,200 cases done in the U.S. 150 physicians have signed on and are doing procedures. So there's not much competition. They have one competitor, Ellipsis, and we've seen that they're not as safe. They're just not as safe. and that really there's a big competitive advantage for WavelinQ over Ellipsis. And so they have non-traditional marketing plan and goals, which make the growth strategy a little more complicated, but it can work out for them, and it probably will if they continue to learn what they can do and grow in what they can do with the product. And then so the SWOT analysis my biggest take out of the SWOT analysis was that the biggest strength was the clinical trial results. The fact that their results were better than traditional surgery results is very good. And then the biggest weakness for me was patient criteria, because you can only use it in 30% of patients, therefore you're very limited, and that's it's kind of not what you want. And then the version of the product development for growth strategy. When they need to use the product development because they need to expand what they can do with the product. So that's all I have today. These are my references. I hope you have enjoyed this presentation. And so this was WavelinQ. Hope you have a good day. Thank you.